Question here. A patient's nutritional intake and laboratory result reflect hypoalbuminemia. This is critical to prescribing because when we get a patient after analysis, we found nutritional intake and laboratory result reflect patient has a less albumin in the blood. Albumin is a protein. Basically, albumin carry the nutrient, carry the medication, right, to the tissue. So they said if patient has a hypoalbuminemia, this is critical for prescribing because distribution of the drugs to the target tissue may be affected. Medication is distributed through the albumin. If albumin is less, medication will not carry out equally to the body. Question 2, drugs that have a significant fast pass effect. So when we eat or when we take the medication go stomach, from stomach to go to the hepatic circulation. But if you take any medication to overlap the fast pass effect, say drugs that have a significant fast pass effect are rapidly metabolized by the liver and may have little, if any, desired action. The route of excretion of a volatile drugs will likely be basically all medication expel out from the body through the kidney. But if the drugs is volatile, it will be excreted through the lungs. Right? Through lungs. Depo-provera, other name is called medioxyprogesterone. Progesterone is a female hormone, is prescribed intramuscularly to create a storage reservoir of the drugs. Storage reservoir is true about what? Storage reservoir increase the length of time of drugs is available and actives. So when Depo-provera prescribed intramuscular and create the storage reservoir of the drugs, the storage reservoir increase the length of times and also available and be actives. The nurse chose to give cephalexin every 8 hours based on the knowledge of drugs what? Drugs biological half-life. Biological half-life, they said. Erythromycin here, erythromycin doing required that the first day dose be twice those of the other 4 days of prescription. This is considered a loading dose. What is loading dose? Loading dose is rapidly achieved drugs level in the therapeutic range. Now, the point in time of drugs concentration curve that indicate the first sign of therapeutic effect is first sign of therapeutic effect. So what it is onset of action. So if I told you what is onset of action, it is the point in time on the drug's concentration curve that indicate the first sign of therapeutic index. Phenytoin, we use anti-seizure psychotic medication, require that the top level is drawn. The peak and top level are done to determine if a drug is in the therapeutic range. So why we check it to see drugs therapeutic range is okay or not, or check to prevent that drug toxicity. Now, they said the laboratory result indicate that the peak level for a drug is above the minimum toxic concentration. This means that the concentration for what? Peak level of drugs is above the minimum toxic concentration. The concentration will produce an adverse response, right? So it is more than the toxic concentration. So because of this, peak level above means they are toxic, above toxic. So concentration will produce adverse response. Next, drugs that are receptor agonist may demonstrate what potency? So agonist, they said, right? Demonstrate what property? It demonstrates desensitization or down regulation with continuous use. It is means the property of this desensitization. Drugs that are receptor antagonist, such a beta blocker. So beta blocker may cause and is an antagonist and exaggerated response if suddenly discontinued. So we will not stop the medication suddenly. It is good to taper the doses. So if you suddenly stop even beta blocker receptor antagonist, it shows an exaggerated response if we suddenly stop. The factor that affect the gastric drug absorption include lipid solubility of the drugs. So here, drugs affect gastric absorption include lipid solubility of the drugs. Drugs administration via intravenous, it begins distribution into the body immediately. So when we talk IV is a very rapid distribute the drugs. So it is distribute immediately. What next? When medication is added to a regimen for a synergistic effect, the combined effect of the drugs is. So they said when you give two drugs together, and we can see the synergistic effect, the combined synergistic effect, what does it mean? Synergistic effect means this one greater than the sum of the effect of each drug individually. So if you give two pain medication together, their total effect will be stronger, right? It is called synergistic effect. Which of the following statement about bioavailability is true? So this question basically talk about what is bioavailabilities of the drugs. Bioavailabilities are especially important for the drugs with narrow therapeutic range and sustained release mechanism. So some of the medication is sustained release, and some of the medication is narrow therapeutic range, like digoxin. So this question, they said, which statement about the bioavailability is true? Bioavailability issue are the especially important for the drugs narrow therapeutic range, like digoxin, or sustained release mechanism. Next, which of the following statement about the major distribution barrier, and the distribution barrier we call blood-brain barrier or fetal placental barrier. So out of 4 statements, which one is true about this barrier? They said blood-brain barrier slow the entry of many drugs into the brain. Drugs are metabolized mainly by liver via the phase 1 and phase 2 reaction. The purpose of both of these types of reaction is they said metabolized mainly by liver via phase 1 and phase 2 reaction. Purpose of both of these types reaction is change the drug's molecules to a form that our excretory organ can excrete. Drugs molecules to a form that our excretory organ can excrete. Change the drug molecule. So once they have been metabolized by the liver, the metabolism may be more active than parents' drugs, less active than the parents' drugs, or they say totally deactive, so they are excreted without any effect. So they said once they have been metabolized by the liver, so basically all drugs metabolism occur inside the liver. So the metabolites may be, what may be, they said more active than parents' drugs. Second, less active than parent drugs, or totally deactive so that excreted without any effect. It is all is above because different drugs after metabolism can show different effect. Some of them become more active, some of them will be less active, or some of them totally deactivated and excreted and they have no effect. In that point of view, all of above is true. All drugs continue to act in the body until they are changed or excreted. The ability of the body to excrete the drugs via the renal system would be increased by what? So when we take the medication, the ending or waste products of drugs is expelled out through the kidney. We say metabolism and expelled out through renal system. So the question is here, when the renal system would increase by how or what? Unbinding or non-volatile drugs from plasma protein. What is steady state? Steady state means when the amount of the drugs in the body remain constant, right? But number one, the point of the drugs concentration curve. Number three, when the amount of the drugs in the body stay below but steady, means constant, no change at all. Question here that two different pain medication are given together for pain relief. The drugs and drugs interaction we call additiveness. Two different pain medication are given together for pain relief, the drug and drug interaction. So if drug and drug interaction is bigger than two drugs, it is synergistic effect. If two drugs we use and one drug reduce the other drug effect, it is antagonistic effect. Additive effect means when ibuprofen and acetaminophen you take together and increase the both of drugs efficacy, additive effect. Action taken to reduce the drug and drug interaction problems, including all of the following, except prescribing a third drug to counteract the adverse reaction of the combination. So they said action taken to reduce the drug and drug interaction or interaction problem include all, except what? Prescribing a third drug to counteract reaction to the combination, because here it's question talking about two medication. Third one is not true for this loss. So phase one, oxidative reductase process of drug metabolism require certain nutritional elements. Which of the following would reduce or inhibit the processes? The phase one oxidative reductase process. Metabolism requires certain nutritional elements. Which of the following would reduce or inhibit this process? Number one, protein malnutrition, iron deficiency anemia. So which one is following reduce or inhibit? If patient has a malnutrition, they are undernutrition, protein malnutrition. Protein is a albumin. Albumin bind with the drugs and carry out to them. So if albumin less, protein less, it can difficult to distribute the medication to the body. Iron deficiency anemia, same thing happen. Red blood cell defective, and red blood cell can carry the nutrient or drugs even. So both is, so they said phase 1 oxidative reductive process. The drug's metabolism require certain nutritional elements. Which of the following would reduce or inhibit this process? First of all, here the protein malnutrition, when occur, drug distribution will be problem. Oxygen deficiency anemia may be problem to distribute the blood, but this question talking about oxidative reductive process. These are one of the metabolism process. They said protein malnutrition or iron deficiency anemia does not participate in drug oxidative reductase pathway. But in case of distribution of the drugs, protein malnutrition can play a role. The time required for amount of the drugs in the body to decrease by 50% is called half-life. What is half-life? The concentration of drugs go to the 50% is called half-life. Now, an agonist activates the receptor and stimulate a response. When given frequently over the time, the body may down-regulate the number of that specific receptors. Let me read the question. They said agonist activate a receptor and stimulate the response. Because it is agonist, not antagonist, not blocking, they stimulate the receptor. When given frequently over the time, the body may downregulate the number of specific receptor. The drug antagonist means the blocking is best defined as an effect of a drug that is modified by concurrent administration of another drugs. So antagonist is the best defined as an effect of the drugs that is modified by the concurrent administration of other drugs. Instruction to a client regarding self-administration of oral enteric-coated tablet should include which of the following statement? So instruction to a client regarding the self-administration of oral enteric-coated tablet should include which of the following statement about the enteric-coated tablet? They said, achieve the best effect if the tablet take with 8 ounces of fluid. So the tablet outer layer has a thin film. They protect the tablet to digest in stomach, right? But it is good to take with 8 ounces of water or fluid. What next? They said the major reason for an crushed or sustained release capsule is that if the crushed or coated tablet is breakdown, what happened? Increase the toxicity. So why will not it crush out? Because of toxicity. Now, what are the following substance is the most likely absorbed intestine rather than the stomach? Sodium. Which of the following variable is a factor in drug absorption? Variables. Factor is drug absorption. A rich blood supply to the area of the absorption lead to better absorption, right? This is the variable factor in drug absorption. What? A rich blood supply to the area of the absorption lead to better absorption. So if blood supply is more, absorption will be more. An advantage of prescribing sublingual medication. So when we eat or take the sublingual medication, what is the medication is? Absorb rapidly. Absorb rapidly. So now absorb rapidly, they said, sublingually. Now here the drugs that is use CYP isoenzyme. This is the enzyme play a role in metabolism of medication. It may be induce the metabolism of other drugs, or it may be inhibit the metabolism of other drugs. It can do anything for other drugs. Therapeutic drug level are drawn when a drug reaches steady state. Drugs reach the steady state means after 4 hours to 5 half-lives. So when drugs go to the therapeutic drugs level reach the steady state, when it go drug reach steady state, usually after 4 to 5 half-lives. Upregulation or hypersensitivity may lead to an exaggerated response if drug is withdrawn. Now, here, regional drug selection.